But essentially what happens is that it's also known as ALS.
ALS, yes.
So the Deeana protocol is what we are testing, and Deeana Tadone is an ALS patient that has been managing the disorder for, I think, going on 8 years. And if you know about ALS, when you're diagnosed, 3 years after you're diagnosed, there's like a 75% mortality. I mean, you're likely to succumb to the disease within 2 to 3 years. So Deanna's, far past that point, and the Deeana protocol sort of originated from her father, Dr. Vince Tadone. He's a retired, very well respected and practiced orthopedic surgeon in the Tampa area. Mm-hmm. And when he retired and his daughter got ALS, he, with his medical training and his knowledge, went on the internet and read research article after research article and put together a comprehensive program called the Deeana protocol. And within the Deeana protocol, the most effective component of that program was the various supplements that were used. And alpha ketoglutarate, which can be bought at a health food store, is kind of like a ketone body. It's an energy substrate that's similar to ketones, medium chain triglycerides that I talked about, right. The supplement GABA and coenzyme Q10, which you're probably familiar with heart health. It helps cells use the food that we eat and convert it into energy. Mm-hmm. So these in combination significantly helped Deeana. And it was found that when they ran out of a particular supplement, which was the alpha ketoglutarate, her symptoms got worse, and then they had a compound pharmacist make more and then gave it to her, and then her symptoms resided. And that happened maybe twice. And so there's these observations that led him to put together the Deeana protocol, which worked very well for his daughter Deeana. So we have a mouse model of ALS that we did studies on, and we looked at motor function, we looked at neurological score, and we looked at total survival. And we found a statistically significant difference in the group of mice that were on the Deeana protocol, the ALS mice. They lived longer, and it helped to manage their neurological problems that they have. And the mouse model, it's important to acknowledge that it's a very aggressive model. There's multiple copies of the defective gene that produce the pathology. So it's kind of like it's a very aggressive form of ALS. So it makes experiments go fast, but right. Some question whether it's even reflective of the disease. Mm-hmm. But we know in some people the disease does progress extremely fast. So in the mouse model, once they start getting the symptoms, it's within about 25 to 30 days they succumb to the disease. So we have that window of therapeutic window where we watch things happen when we give them these supplements.